He's on the board of trustees of the American Society of Gastrointestinal Endoscopy and on the board of trustees of a Chicago medical school. Please welcome back to the program Dr. Carrie B. Strom. Dr. Strom, thank you so much for taking the time. We know how busy you are.
Hi, Larry.
Carrie, since the last time we've spoken now, the numbers of death in this country have exceeded 1,000. Are you surprised?
I am not surprised. A little bit, but not shocked.
You know, Doctor, the model that virtually everybody is basing their projections on is from a study from the Imperial College out of the UK. And they have now dramatically downgraded the number of people that they believe will be dead, both in America and in the UK. At one time, they were saying, Dr. Strom, that 500,000 people would die because of the coronavirus in the UK. Now they're saying it's 20,000. Now, this is a study on which people are basing all these decisions, including the decision to essentially shut down their economies.
Yes, because, I know that study. I was out of Oxford. And what they were saying in that article is, and there's really no way to know, but it seems like a lot of people have been exposed, asymptomatic, and carry the antibodies. So, like I told you last time, all the stuff is probably better to err on the side of caution because we don't have the data. And I told you from the first time that I was on the show, even though it's scary and you have to prepare, but it's probably not going to be as bad as the hype of the media, but we just don't know. We don't know how many people were infected asymptomatically. We just don't know these numbers because we haven't tested that many people. We're testing the most severe cases, and out of those patients, there are going to be people that are dying because we are only testing people that are sick.
Mm-hmm. And Dr.
How do we really know the raw data there? I always think, and I told you from the beginning, that denominator is going to get bigger. And so the number of fatalities is going to diminish, but since we don't know, it's a novel virus. Even though we've had coronaviruses in the past, the SARS and the Mediterranean MERS, they're different viruses. They're different mutations. So I think there's no other policy to make as opposed to err on the side of caution until we know. We don't want to lose lives.
My guest is Dr. Carrie Strom. Dr. Strom, the only country in Europe that has not shut down its borders and is not limiting crowds of 500 people or more is Sweden. And they're claiming that they're relying on their experts, and they say it's better to track the cases within their individual country than to shut everything down.
Well, look, if you're taking that as an isolated what's the word I want? An isolated event. If you don't have an economy and people are if you're just worried about deaths, I suppose isolation is the best because we don't have a vaccination. And short of a vaccination, we can't immunize the population. Isolation is sort of, take it, if you will, a pseudo-vaccination. Because we vaccinate each other so we don't expose each other to this virus. So in fact, in a sense, an isolation is like a pseudo-vaccination. It's a lot more severe. Now, if you take that into the content of the real world with the economy and the psychological overlay from the disease and possibly getting this, I don't know if the treatment is better than the cure. I think if we're just looking at deaths and wellness of people, isolation is a good thing. But there's a massive fallout from this, and I'm not the one to give you the answer on that.
Mm-hmm. My guest is Dr. Carrie B. Strom. Dr. Strom, my sister-in-law is a healthcare professional. She is she's still going into the office, but the patients are not there. They're doing it by telemedicine. Is that how you're handling things as well?
Yes,
mm-hmm.
Yes, and actually, I love telemedicine. I'm in the office right now with my staff, and we did telemedicine today on many patients, and patients like it. Honestly, I think this is the Amazon of healthcare. I
mm-hmm.
think patients love it. Patients don't have to come to the office, take the time, pay the parking. And 80% of visits I can triage by looking at the patient and looking at their medical record and listening to them. I get a lot by looking at the patient. Now, obviously, touching them, doing their vital signs is very important as well, but I think this is going to change the whole way in which healthcare is provided. Patients don't want to come into the office. CMS recently got smart and started paying for these things that we never were paid for before, like phone calls. Doctors would spend a lot of time on the phone with patients, but they were never reimbursed. But this is what we did. I think right now, I made this ad, Larry, that doctors are going to be viewed in a different light. They're going to be the firemen from the Woolsey Fire on steroids, and we're going to be appreciated a lot more. And I do believe this telemedicine is a great thing, and I think it's going to carry on past the pandemic.
Dr. Strom, have you and your entire staff been tested?
No, we have not.
Because?
We're feeling well.
Mm-hmm.
We will mask in the office. If somebody has a cough or a cold, we'll put a mask on. But 98% of people that have COVID-19 do have a fever, and none of the patients, none of us are febrile. We're not seeing people in the office now. We're amongst ourselves, and we've been together probably for a month and a half, and none of us have been exposed. And you would think if one of us were going to get it, we would have had it by our exposure already.
Mm-hmm, mm-hmm. Just a few seconds left, Dr. Strom, in this segment. Are you having difficulty getting masks and other PPE?
We are not, but I will tell you, I do have a surgery center, and we have stopped doing elective procedures there for a couple of reasons. Number one, because the virus may be aerosolized in when we do an endoscopy, so it's probably not safe for the patients or the staff. And secondly, we don't want to be using up this equipment for elective procedures in this time of need.
Okay, Dr. Strom. Don't go away. 888-971-SAGE. Call Dr. Strom.